Welcome back, and everyone, to Understanding CBD. I am Stephen Wallman.
I am Max Sobel.
Hey, what about me?
After
I'm Linda. Hi.
And we have the beautiful Linda in studio with us today. Thanks for staying with us. I'm really excited about this episode today. It's actually a call-in episode. We already have some calls queued up for our man, Doc G. The number here, if you haven't heard it yet, it's 410-922-6680. And if you haven't heard, our special guest, Dr. Benjamin González, medical director at Atlantis Medical Wellness Center in Silver Spring. Max, we see him here every week. We hear from him every week, but it just feels like we don't get enough.
That's right, Doc. How you doing?
Hey, gentlemen, I'm doing good. Hey, I like that Beethoven's Fifth with the salsa flair.
We did that for you, Doc. We did that for you.
That was nice.
We're really, really happy to have you here. But I got to tell you, if there's somebody in the studio that's most excited to fire some questions off at you, it's got to be our guest Linda today here.
I can tell. Here we go.
Hi, Dr. González.
Well, hello, Linda.
It's very nice to speak with you.
Nice to speak with you, too. It was great listening to your previous episode. That was good.
Thank you. You know, I'm a huge fan of yours. I follow you on Facebook and Instagram, and I listen to your segment every single week. Even if I miss some other parts, I always stay tuned for you. And I just always have so many questions, so I'm really excited to get to speak to you live today.
Thank you.
Linda, do you want to start out with a question? We have a caller online. Do you want to start with a question first?
Yeah, so...
Wait a second. Before you do, when I said that, Noah just switched her online, which is fine. Doc G, we're going to start out with a question from a caller, okay?
Sure.
This is Joanne from Arizona. Joanne?
Yes, I'm here.
Hi, welcome to the show.
Hi, thank you.
Awesome. And you have a question for Doc G. I know he's ready for you.
I do. I'm wondering if CBD is safe for teenagers to use. And would it help, and how does it help?
Yeah, that's a good question. So CBD has been noted to be very safe to use in kids. And, of course, it depends on what we're talking about as far as what we're treating. The important thing to understand is that if the child or the teenager is on another medication, that you need to be careful about the interactions of medication and CBD. But CBD has been used quite well and has been shown to be safe for things like anxiety, depression, ADD symptoms, even symptoms of acute infectious disease processes, or the pain or chronic pain, even in things like autoimmune issues. We'll see kids in my clinic with eczema, with those types of issues, and we'll use CBD to help treat that and help with the underlying chronic inflammation. Did that answer your question?
Yeah, I was just wondering more for anxiety was kind of what I was thinking. And
especially this past year with what's going on with school and the changes with the changes in getting online and trying to keep up with what's going on online with school and not being able to see friends or go out. We've been seeing a definite spike in anxiety in kids and young adults, for that matter. And we do utilize CBD for those instances, and it's very safe to use. My recommendation
is as needed?
For what?
Is it to be used more as needed, or do they need to use it daily?
So it depends on what's going on with the anxiety. If it's somebody with acute anxiety for a specific reason, then you can use as needed. But if the child has an underlying anxiety issue or ADD issue, then I always recommend a little bit of CBD each day, a little bit in the morning, anywhere from 10 to 25 milligrams in the morning of a full spectrum CBD, and same at nighttime, so twice a day. And then during the day, it can be used. It does not make you sleepy. It doesn't give. It doesn't have the hallucinogenic effects. Of THC, and that's one of the confusions and one of the reasons for a lot of parents' concerns for the use of CBD. So I would test it out, find a good full spectrum CBD, and anywhere from 20 to 50 milligrams, 10 to 40 milligrams, depends on the size of the child.
Okay.
Great. Thanks
Did
for
that
your
help?
thanks for your question, Joanne. We appreciate that. Obviously, you can always
that's great.
follow up with more. We have a line of callers here. Linda, you should have gotten your question in sooner.
You had your chance.
Let's
All
see.
right, I'll wait.
We have. This guy's got a great name. Jupiter, Florida. His name is Steven.
Another Steven?
Doc G.
Doesn't the universe explode when two Stevens are...
This is a question you get a lot, and we've talked about it on the show before. CBD and migraines. Steven, you with us?
I'm here.
Awesome. Thanks for calling in, Steven. You got Doc G.
Hey,
Yeah.
Dr. G, how are you doing?
Oh, good. It's another day in paradise. I bet it's in paradise down in Jupiter.
It's paradise down here as well. So I get migraines and wanted to see what CBD could do and what you recommend if that could be beneficial.
That's a great question. It's one of the most common conditions that we see in the clinic as well, migraine headaches. And unfortunately, with migraine headaches, there's all sorts of different reasons for underlying migraine headaches. We're still trying to figure out in medicine what's the cause of migraine headaches. There's so many different reasons, whether it's an underlying inflammatory problem, whether it's an overt disease process that's causing the migraine headache. There's so many different reasons for the migraines, but one of the commonalities is inflammation. And CBD has been shown to calm down those inflammatory processes that cause the spasms of the blood vessels that cause headaches, that causes the inflammation that makes these headaches occur. And of course, the definition of migraine headaches is a headache that's been there for quite some time, probably started as a child, and it's repetitive. It's not your usual tension headache or headache of lack of sleep. So yes, CBD can be very powerful when used, especially when combined with things like a chelated form of magnesium. One of my favorite combinations to help with migraines is chelated magnesium, 125 milligrams to 250 milligrams, along with the CBD, about 20 to 50 milligrams of CBD, a full spectrum CBD. And it's great for prophylaxis, for the prevention of migraines as well.
Thanks, Dr. G. And the other question I've had is, in addition to magnesium, I've heard oxidative stress can also play a role in kind of having a bad foundation that might trigger antioxidants. Is there any science to that, or anything that
Oh,
I could do
absolutely.
for that to help complement?
Sound like
some of the
you've been
treatments?
researching your
Doc, I told you we have an educated listener base
Yeah,
here. Okay.
That's awesome. I mean, and frankly, I could go on about that. I could talk for hours about that subject. So if you have a poor underlying diet, or your gut has a poor ability to absorb nutrition and good nutrition, then that can cause issues with how your body processes antioxidants. And antioxidants are those molecules in your body that help with fighting off diseases and fighting off oxidative issues. And what do I mean by oxidative issues? The stress on your cells in your body that cause your cells to die early or to age fast. So yes, taking care of your diet, taking a proper, clean supplement that includes a bunch of good antioxidants, along with the magnesium, along with the CBD, can really be powerful in the prevention of migraines. I've had patients tell me that, Doc, I've tried everything for years, nothing's worked, but that the CBD, the magnesium, and the antioxidants that you recommended me has literally cured my migraines, and I love hearing that.
Great. Thanks, Doc J. Thanks, Steve. Hate to
no
cut you
problem.
off. We have a line of callers for you, Doc, so I want to make sure we can get to as many as possible. We do appreciate that, Stephen. Before we take, for those that are just joining us, we're with Dr. Benjamin González. He's with Atlantic Medical Wellness Center in Silver Spring, Maryland, and he's answering questions right now from callers and people that have a lot of different questions. We have someone here next on the line, Doc. This is Louis or Luis. It's hard to tell by Noah's handwriting here, but he has had some back problems, and he's actually talked to you before about them, and has some things to talk about.
Hey, Dr.
Luis.
Louis, how are you?
Yeah.
Is it Louis or Louise?
Louis.
Louis. Okay.
Yeah. Yeah, I'm a current patient of Dr. Ben, and he treated me. I had many years of back pain, and I tried almost every medication out there. And a couple months ago, Dr. Ben recommended CBD oil. Started taking it morning and afternoons. It's been about 3-4 months now, and I wake up completely fine now.
Amen.
And yeah.
Wow.
And actually, I'm glad you called, Louis. I really appreciate you calling and telling people this, because chronic pain is a difficult thing to treat. And back pain even more so, for multiple reasons. But Louis is a good example of, we did some other things as well. We kind of changed diet a little bit. And nothing dramatic, just changed diet a little bit, changed the timing of how we ate, and added a little CBD to it. And here's one of the many stories that I hear of chronic pain resolving with a little bit of intervention. I appreciate you calling in, Louis.
Yeah, no, thank you. Thank you so much for helping me out. I'm getting through the day and running around now without pain.
Now, Louis, I have a question for you, because we get this question asked a lot from us, is when you start using it for back pain, did you see instant results, or did it take a little bit of time?
No, it took some time, honestly. It probably weeks, I would say. Not instant, but like you can feel like a weekend, you can feel like less aggregation, I could say. And like 2 weeks in, you can like start feeling it less and less until you get like a steady routine going.
And if I recall, Louis, we had to titrate the CBD a little bit. We went up, we went down, until we found the right dose that helped keep that back pain away. Was that true?
That is correct.
Yeah. And we finally settled on the right dose, and it's worked for you ever since. That's great.
It's amazing, Doc, that you've been helping these people this way. And we know that because we've been talking to you now, but now it's the audience's turn to actually really get to know you a little bit better. Stephen, do we even need to do a show anymore? I mean, honestly, we're just connecting people to
I wish
Dr.
we didn't. I wish that everyone knew everything already, but we got to keep going at this. There's still where such a small amount of people actually know that these things are even possible. So thanks for calling in, Louis. And of course, Doc G, great for treating him. But it brings a great point that, the body heals itself, but it didn't get injured overnight. So we got some time. You got to put some time into it sometime. We have one caller. We may not be able to get her before the break, Doc, but I wanted to give you her question. This is Jesse from Arlington. She wants to know how long a dose lasts. What's a typical response that you can give to someone? Because it's always like, how if I get a gallon of gas, how long is it going to get me versus Linda in her car, Doc? How do you answer that question?
Oh, yeah. So it's like kind of like asking, how much or what type of medicine should I be taking, or how much food should I be eating? It totally depends on the individual, medical condition that we're treating, the weight of the individual, the age, the hormone status, the nutrition status. All these things matter. So typically, a dose of CBD for a chronic condition lasts anywhere from 4 to 8 hours, and sometimes it can stop the trigger of that issue and stop the problem for days and weeks at a time. And that's a cool concept. That's a whole nother discussion.
Well, Doc, we have much more to go into. We have to take a break now. We have callers on the line. If you're still there, please hold. We'll be right back with you with more Doc G.
Thanks, Doc G.
We've already tackled some great questions about some pain and some anxiety in children, some migraines and headaches. A lot of great job, Doc G, answering these questions. But Linda still hasn't had her chance to answer a question, so we're going to give the microphone to Linda now. And,
drum roll.
And Linda's going to ask some questions.
Thank you. Hi, Doc G again. So my question is maybe simple or complicated, I'm not sure, but here goes. What is integrative and functional medicine? Like, I know what a cardiologist is, and I know what a dentist is, but I'm not quite sure I understand that specialty.
Well, here's why you don't understand the specialty. It's just a phrase and term that's been kind of abused, used, and mixed with other things. It's kind of like the term organic, or natural. It's kind of overused. Functional medicine is the idea that, and to be very clear, I'm an MD physician, medical physician. I graduated from the University of Arizona. College of Medicine. Functional medicine is the idea that your body doesn't work by itself in its metabolism, that all the organs work together in a symphony type of reactions to help maintain who you are physiologically. Functional medicine is the understanding of that. So just because somebody has an infection doesn't mean they just need antibiotics. They need to take care of their gut. They need to figure out what's going on with of how the infection started. It's the idea that your body each of the systems in your body, the organs of your body, doesn't work by itself.
Right.
Functional medicine practitioner understands that and tries to attack who you are physiologically to make sure that not only you're doing well at this moment, but that 2 years, 5 years, 10 years from now, that we're trying to prevent disease from happening in the first place.
So it's like a holistic and proactive approach to taking care of a patient rather than a system-by-system reactive approach.
Yes, and utilizing, of course, updated science in the medical physician, MD approach to the care of that individual. So understanding both the traditional care and integrative care.
So you're like the endocannabinoid system, right, Doc? Is that what you're saying?
Yeah.
Okay.
Yeah, exactly.
Just as long as
a lot of us doctors don't know what the endocannabinoid system is, and that's a good example. It's a great example.
I try to add value every day, Doc.
And, I'm glad you asked that question, Linda, because it's something that needs to be defined and clear, because there's a lot of different wishy-washy words out there.
So you touched on another one of my favorite topics, gut health. So some of us have dug into that topic and realized now that most of our immune system is right there in our gut, and having gut issues can really impact your overall health. So is there a role that CBD plays in improving your gut health?
100%. Remember the old adage,
you are what you eat?
Yeah. Well, that's just not true. It's you are what you absorb. So that's what it really is. You are what you absorb, what you can absorb. So CBD, actually, there are CB receptors in the gut that play a powerful role in the way your gut absorbs nutrients, and the way your gut, and your gut is a big part of your immune system. CBD can help calm down those issues. It's one of my favorite things to use for my irritable bowel, my Crohn's disease patients, my patients with gut issues. It helps calm down the inflammation, underlying inflammation of the gut, that allows for the gut to heal and for your immune system to get in the right place. Absolutely, it's powerful for that.
So another thing I've seen you post about on social media is intermittent fasting, and that's something I've also experimented with. And I've used CBD to help me get through being hungry when I wasn't ready to eat with my intermittent fasting schedule. Do you have any insight on that?
Absolutely. So the interesting part about how your body says that you're hungry, part of the pathways that do that your gut and your brain communicate with itself, the CBD helps that communication, actually. Helps communicate those nerves that are attached to the center part of your brain, the hypothalamus of your brain, to your gut, and allows for you to not worry about hunger, to calm down the hormones that cause hunger when you are fasting. It's very powerful. So I do intermittent fasting myself, and I utilize CBD during those times as well. And by the way, I use CBD in my weight loss programs because it helps attenuate or calm down those pathways in the brain that demand someone to eat, even if they're not truly hungry or don't need food. Because, you walk out and you see all these fast food places, you smell them and you want to start eating. You go to the gas station, and instead of getting gas, you get a pretzel, a hot dog, and a candy bar.
Oh, I don't know what you're talking about, but we got to end this, Doc. Obviously, this was a popular segment. We're going to have to do this again.
Definitely.
Thanks for joining us today on the show. Everyone, stay with us. We'll be right back with everyone's favorite segment, Mail Sack.
Mail Sack!
Be right back. Thanks, everybody.
Baby.